Hello, I am Vissers from Erasmus University in Rotterdam, and I will present the methodology developed and used in managed outcomes. We developed our methodology by elaborating the initial conceptual model. We distinguished first the operational model to study the link between the production system and performance. Then we developed a user survey to study the outcomes from service delivery from the perspective of the user. We investigated the relationship between cost of services and outcomes by economic modeling. And finally, we developed scenarios for each of the cases investigated. I will concentrate in this presentation on the operational model. The other parts are covered in separate presentations. This slide summarizes the approach followed in the case studies. We describe the relationship between demand, services, the journey of the user through the regional system, the resources used, the outputs and outcomes. This we call the operational model. It serves as the backbone of our study. We also describe the operations management practice, the planning of services, the collaboration between partners in the network, and the innovation of services. Around this description, we collect data on population structure, the regional infrastructure, the costs and reimbursement of services, and then on top of that we have the view of the users on the functioning of the service delivery system. In this way we create a rich picture of the performance of the regional delivery system. In this slide we see once more the components of our approach described: the operational model, the operations management practice, the outcomes, the user experience, and the cost and reimbursement. The next slide shows in more detail the mechanisms in the operational model. We describe the demand for services arising from a region with its population in the form of demand locations and demand segments. Demand locations allows for distinguishing different levels of demand in the areas in the region. Demand segments allows for distinguishing between different service requirements arising from subgroups in the target population, for instance the demand for prevention or demand for treatment. Then we follow during 1 year the new users that enter the system and describe the demand for services from these users. We describe this by following the patient journey of patients through the system, identifying patients by their demand location and demand segment. Then we relate this to the resources and the costs involved. We developed a handbook for using this methodology to uniform the collection of data for our research. In each country, we selected a case instance setting, often based on established relationships between hospitals and researchers. The case instances selected are therefore exemplary settings and do not need to be representative for a country. We installed a case instance team with representatives of the local partners and the researchers. We described the delivery system using the operational model. We collected data on the performance from hospital information systems and clinical databases. And as last step, we performed the patient survey. Then we performed a comparative analysis, which is something completely different from a standard benchmark approach. The research challenge was to compare with different cases, while there were only a limited number of cases that did not form a homogeneous group. Then the case team, with the partners involved in the case instances, used all the material to perform a number of analyses. Examples of analysis are listed here. The first ones are straightforward. But when we move to investigate the relationship between costs and outcomes, for instance, we used a methodology reported in literature to relate multiple inputs to outputs, in case inputs are not substitutable. This is of course from the researcher's point of view an interesting part of the study and provides actually an alternative approach to benchmarking, a process-based approach to compare outcomes and be able to relate it to the way processes are organized. This results in a multi-perspective view on the functioning of a regional delivery system. In the middle, the regional delivery system as object of research. Underneath, the operational model as a backbone of our managed outcomes approach. Then we add data from hospital systems on service performance and medical outcomes. Finally, on top of all, we have the view of the user on the functioning of the system by his experience and evaluation in terms of satisfaction with services and health as perceived. This results in a rich picture with results from different perspectives, the best start for making changes that add performance improvement from the perspective of providers as well as from experience by the final users of the system. To conclude, some remarks on the managed outcomes approach and its contribution to improving regional health service delivery. We have used this methodology and tested it in the 4 cases: type 2 diabetes, stroke, hip osteoarthritis and dementia as comorbidity in emergency admissions. Our local partners in the study expressed their interest in adopting this approach in healthcare practice. Therefore, we are confident that this approach can contribute to improve health service delivery in regional systems. As the cases are covering different types of processes, emergency processes as well as elective or chronic processes, the approach of managed outcomes can also be used for many other patient groups. Thank you very much for your attention.